Very excited to have Jessica Rousset.
Rousset,
well, because I don't want to mess up the name.
She's probably
you
Canadian.
can go either way. Because
probably Canadian.
If there's an E at the end of the name, it would be Rousset.
Right.
But there's no E, it's Rousset.
Is there a tilde or a...
No, there's not. Jessica Rousset is the Chief Operating Officer of CURE Pharmaceutical.
Is it French? Well, it's see.
Well, normally we get Rob Davidson via Skype, but we saw him in person, and
it's not so.
It's just not so. The outcome wasn't what we wanted.
No.
Especially, and then we got to talk to Jessica. We figured out the real brain behind the organization. By the way, CURE Pharmaceutical improves the patient experience by making it basically easier to take medications. I mean, it's about as simple as it comes, isn't it, Jessica?
Yeah, that's well summarized. We make the patient experience easier, and we make drugs safer and more effective.
And that was a nightmare as a kid to swallow an aspirin. I remember really still having a problem sometimes.
I was talking to her before the show, and that's a big piece of this is kids being compliant, right? I mean, how many medicines are prescribed versus how many medicines are taken? Right? There's a disparity, correct?
That's absolutely true, but it's really not just kids. Actually, about 40 to 50% of the people, the population overall, would rather not take a pill. Okay. Or does not want to swallow a pill or has trouble swallowing a pill. Yeah. Sometimes it happens, I think, in childhood when you have a traumatic experience, gagging on a pill.
Yeah. Yes.
And then throughout life, if you can avoid it, you'll avoid it.
Cystic fibrosis patients have to take 50 pills a day, every single day. So this is why this is disruptive, because you guys have this 3-layer technology called CUREfilm, which we're going to show you.
Or more layers too? Is it just 3? Or
well,
you can just keep laying them on, because I wanted peppermint with cinnamon.
It is as simple as this. This is CUREfilm. Okay. This is and so talk to us about what I'm holding up here, because this is pretty.
Yeah, this is an oral thin film. This particular product is our high-dose vitamin D product for a once-weekly application. You don't need water. It actually tastes quite delicious, and you just have to take it once a week to get your blood levels and vitamin D where they need to be. It's sunshine in a packet. It's sunshine in a
That's not a tagline, by the way.
My vitamin breakdown. Vitamin D, I thought was you get from just standing around the sun, but.
You can, although you can also get cancer that way. So
damn it.
Yeah, taking it through food or supplementation is a good alternative.
That's good.
Yeah.
Jessica, this is about molecules, right? This is about creating a molecule slurry and creating medicines and making it easier for us to absorb as well as take them. So talk about all of the benefits, because it's not just about making it easier to take pills. We absorb better in some cases, right?
No, that's right. So there's the patient experience and making it easier for them to take the medication, but it's also making the delivery of that molecule more effective. So getting more into the bloodstream faster, right, and in a more sustained way. So we focus mostly on small molecule drugs, but we can work with lots of different drugs that have these problems. They don't get absorbed effectively. So you have to give a lot of the drug to get the effects and the blood levels
and the time that it takes.
And the time that it takes. So if you can make that process more efficient with a better delivery technology, that's the solution, and that's what we do.
We spend a lot of time on the website. In fact, if you're listening to this on the radio and you can't see it, it's CUREpharmaceutical.com. CUREpharmaceutical.com. They happen to be publicly traded under the stock symbol CURR. And Jessica is the Chief Operating Officer. So talk to us about all the stuff you're creating, because it's not just vitamin D, although I can tell you, we did a story, I think it was last year, about the amount of vitamins that are tossed in the toilet every year because people buy them, they expire, they don't take them. It's not just the vitamins. This is real medication you're talking about.
Yeah, look, a molecule is a molecule. We work with improving the delivery of molecules that are sold as supplements, like the vitamin D. But we also work on drug products. So our first drug product is the first film form for Viagra.
Hello.
Sildenafil. There you go.
Donde está sample? All right.
The patent.
Russ, you can put that in your wallet now.
Yeah, right.
Never thought about that. Of course, Rob Davidson never said this when he was on the air. We get the Chief Operating Officer that tells us about this stuff.
Spend 5 years in my wallet high school.
The first question I have is, let's talk about FDA, because FDA is going to have to give you guys the blessing, right? It's not just about the drug, though. It's about how you take the drug, right?
Yeah, absolutely. So for a drug product, obviously, it's a much different path to market, and it's an FDA pathway that is faster than a new molecule, however, because Sildenafil is a known drug. We know the safety, the efficacy of the drug. drug. So now we're just delivering it better.
Right. Once they make generic, then
Yep.
obviously it's you've
And
doubled.
I want to go back to the time of that it absorbs and gets to work.
Yes.
Because that's
She's not here to talk about drugs. She's here to talk about drug delivery.
Because generally you have to wait that time to digest.
easy.
Listen, you're right. Speed of onset is one of the benefits of
Thank
our
you.
technology for this particular
I'll let
product.
you guys go.
No,
'Cause
we're
you know
good.
what?
No, that's the only question I had.
You're the only two that aren't uncomfortable with this conversation.
And I'd like a dozen.
The
please,
talk about the cannabis business, because obviously
What?
we've got. Well, I'll tell you why.
This is
because,
my birthday or
yeah,
something.
it really is. Russ, this is your favorite guest in the history of guests.
Love her.
This what's interesting is we've seen a lot of investment verticals on this program. We saw the China companies that were so in vogue back in the early 2000s. Then we saw the cybersecurity rush. Then we saw the cryptocurrency. Cannabis is obviously one of those. It's a little bit different because think prohibition into making alcohol legal. This is cannabis has made literally millions of otherwise law-abiding citizens criminals until recently.
Unfortunately.
This is a real vertical here as far as investment goes. Talk about how you guys are intersecting that with Cure and cannabis.
Yeah, I mean, obviously, the promise of these molecules and the understanding of the endocannabinoid system, we're just sort of scratching the surface, right? Because we haven't been able to do research for a bunch of legal reasons.
Yeah.
But we believe that there's going to be so much benefit that will be uncovered, and but these molecules are tricky. They're not very stable. They're sensitive to oxygen, temperature, heat, water, and so being able to stabilize them in a dosage form is critical to their commercial success.
So all molecules aren't like that, huh? You're saying that the cannabis molecules are a little different?
Well, here he goes, trying to find another reason.
One question. I'll leave it
Molecules
alone.
It's a great question because vitamin D is one of those kinds of molecules, which is lipophilic. It likes fat. It's soluble in fat. And our body is mostly water. So that's a problem to solubilize those drugs and get them delivered. So what we've been able to achieve with vitamin D and stabilizing it in a film, we believe we can achieve to improve the delivery of cannabinoids.
All right, we'll get back to work.
Stay right there. We're not letting you out of here yet. We're going to stay on because there's a couple of other things like sleep that they can help you with.
A molecule is a molecule.
Unless it's a hemp molecule, but there's a special molecule.
It sounds like a shirt Sheldon might wear.
It's just a molecule.
Okay, I'm excited
It's
now.
it's like a Scotch molecule, Scott. Russ?
What?
Yes.
Sublingual scotch? I do that anyway. Right under the tongue.
I got a little Ron Burgundy there.
Yes, it was.
I got a little Ron Burgundy. Jessica Rousset, Chief Operating Officer of Cure Pharmaceutical, joins us here in a second. Smartest person in the room by a lot. Stand by.